of children with acute lymphoblastic leukemia, and I welcome Jingting Wang to the podium.
Hello everyone. I'm Jingting Wang from Shanghai, China, and now I'm an international visiting PhD student in University of Toronto, Canada. So today it's a great honor to be here and share you with my PhD study, designing Caregiver Assistant, a smartphone app to support caregivers of children with acute lymphoblastic leukemia. So my presentation will include these three parts: the development process of a care assistant, usability of care assistant, and the ongoing effectiveness evaluation. So as you can see in this picture, it is the change in pediatric cancer incidence rates, and this black line represents for acute lymphoblastic leukemia, and its incidence rate is increasing. This is the age at diagnosis of ALL, and the pink age is from 2 to 4 years old. So due to the limited cognitive ability of the children with ALL, family caregivers, especially for their parents, are essential in delivering complex health care service. So caregiver will have physical stress, psychological impacts, negative emotion, and economic burden. Theory has shown that during the caregiving process, providing information and support to the caregivers will improve their satisfaction with care and the parents' emotional well-being. So our research group is thinking of doing something in the caregiving process. Caregivers want to have more evidence-based information and social support. They want to communicate more with doctors and nurses, and they want to have more disease-related knowledge, and they find it not very convenient to treat their children's treatment and medical results. So interventions for the family caregivers need to be developed, and the support tool that can be reached whenever and wherever caregivers need is very important. So mHealth is a good way to solve this problem. mHealth is a type of e-health, and it is defined by WHO as a medical and public health practice supported by mobile devices such as mobile phones, patient monitoring devices, personal digital assistants, and other wireless devices. So mobile phone is becoming more and more popular in our everyday life, and the smartphone app is a good tool to support the caregivers. So our research team developed a care assistant, this smartphone app. And first, we built a multidisciplinary research team, including the physician, nurses, software engineer, and also us researchers. First, we have the individual interviews with the caregivers, and we interview them about the difficulties and needs in their caring process and their attitude towards using mHealth, especially for using a smartphone app to support them. And then we hold the first round of group discussion with the physicians and nurses, and to talk about from the physician and the nurses' perspective, what's the caregiver's difficulty and needs, and the current situation of the caregiver support, also their perception on using smartphone app in supporting caregivers, and their suggestion about the structure and the contents of this app, and also about the backstage of this app. Then we drafted the structure and the content of this app, and we hold the second round of group discussion with the physicians and the nurses, and to talk about, to let them see if the draft structures and contents are reasonable and scientific and also comprehensive. And then we form the formal structure and content of this app. And we hold the third round of the group discussion with the physicians, nurses, caregivers, and also the software engineers, and talk about how to transform from the text to an app, and the easier and more accessible way of the app's presentation. Also, the caregiver's preference of the interface and the system operation, and their suggestion about the backstage development and management. And we form the formal protocol for the app and the web-based backstage. And we have our software engineers to develop the smartphone app and the web-based backstage. So this is the app we have developed. It has eight models, including the personal information, treatment tracking, family care, financial and social assistance, knowledge center, self-assessment questionnaires, interactive platform, and also the reminders. And then I will show you some screenshots of this app. This is the homepage, personal information, home care, social support, questionnaire. This is the knowledge center and the questionnaire. And we have a web-based backstage. It has 4 functions, including collect the caregivers and the children's demographic and disease and treatment information, and collect the data of the self-assessment questionnaire model and for deeper statistical analysis, and check and publish the data users uploaded through the interactive platform model. Also, we have a hotspot in every page of family care, financial and social assistance, and knowledge center. Then we can record the exact time and the lasting time of every user's days on each page of these 3 models. So this is the screenshot of the web-based backstage. And then we tested the usability of this app. First, it was evaluated by the healthcare providers, and for 2 physicians and 4 nurses. This is the eligible criteria, and we gave a brief introduction of the app to them and gave them a smartphone with this app. And they scanned the interface and explored each model. And we interviewed them with their using experience, and also we observed their nonverbal behavior. After they gave us the suggestion or comments, we revise and update this app. And the caregivers think that the content of this app is scientific and comprehensive, and it could benefit both caregivers and the medical staff. And also, caregivers gave us some suggestions, including to add some information about how to prevent and cope with the side effects, and to build support for the real-time interaction, and also some cosmetic changes of this app. Then we have our update care assistant. Then it was evaluated by caregivers. By convenience sampling method, we have 15 caregivers, and they use this app for 2 weeks, and we talk with them about their using experience, and also we get the browsing time of the 3 knowledge-related models from the backstage. So caregivers think that this app was reasonable and scientific structure, and it is user-friendly, and it gave them convenience access to disease-related knowledge, and they have more social support, and they found that they are more convenient in the caregiving. Also, they gave us some suggestions. The first is to have different forms of information, because most of the information in this app is in text, and they want us to add some pictures and videos. But we also think that if we add these pictures and videos, it will cost a lot of data when they download these materials, and it could be a barrier for them to use this app. Also, they want to improve the real-time interaction. They think that even though the backstage team gave them answers of their question, but not in a very timely manner, and they want to have more social supports from sources. And this is the browsing time of 3 knowledge-related models, and as you can see, there are totally 214 pages, and the caregivers belonging them for 1,654 minutes during the 2 weeks. It means that averagely, every parent spend about 8 minutes every day in scanning these three knowledge-related models. Totally, they find that their smartphone did not have any software failure during the 2 weeks usability test, and they find it very stable, it is useful, it is simple to use, and it is a self-explanatory app. And the third part is our ongoing effectiveness evaluation. So this evaluation was conducted in 2 hospitals in China, and the participants are parents of children who is less than 15 years old and diagnosed with ALL and is going to have the first phase of the chemotherapy. And the parents should have a high school diploma or higher education and able to communicate frequently in Mandarin Chinese, and the average home family income is 2,000 yuan or above, and they need to have a Android smartphone with access to the internet. And this is a mixed method study, and it is time interrupted, and cohort study with 50 caregivers in each group. So we first have the observation group with 15 caregivers, and they have the regular health education in the hospital. And the intervention group with adding the app-based health intervention. And firstly, we collect the data for the observation group, and in the baseline, we collect the demographic data, social support, anxiety, depression, care burden, quality of life, disease, uncertainty, and the knowledge they have already had and they need. And after 3 months observation, we have 2 kinds of data to collect: the quantitative data, including the baseline data, and also the frequency of emergency of the child and their treatment cost. And about the qualitative data, we interview with the caregivers about the satisfaction with care. And then we have after we collected the 50 caregivers data, we begin our intervention group. And at the beginning, we also collect the baseline data. And after 3 months intervention, we collect the data with adding is the browsing time of the 3 knowledge-related models. We collect this data from the backstage of our app, and we also add the experience of the intervention to interview with the caregivers, and then we analyze the data with the to have the effectiveness evaluation. So thank you for all your attention. Any questions? Oh, it is still ongoing, and we are collecting data from the effectiveness, the intervention group. Hi.
The 2,000 yen per month income, is that considered to be wealthy or middle class or poor in China?
I think it is lower than middle class. Yeah. Okay, thank you for your attention.